Guys, welcome back to Medical Coding with Blue. Today's episode is all about what to look for in a medical billing and coding program. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So if you have decided to start pursuing the medical billing and coding career field in 2024, here are some things to look for when you are trying to pick out a school. Now, I will get into at the end what I recommend, but here's the thing. I personally do not recommend any online trade school or program online specifically because of the simple fact that I haven't been to these programs. So if you ask me about specific schools, I cannot answer you, and I won't answer you because, again, I don't know about their program, and I'm not going to promote something that I've never been through, okay? My audience is very important to me, and the information that I give out is very important to me. So I want to make sure that you all understand this. The things I'm talking about today are the things that you want to look out for if you are trying to pick out a medical billing and coding program, okay? So the first thing that you want to look at is this. If they're telling you that this is a 2-month program, a 4-month program, a 6-month program, meaning that all of the things that they're about medical billing and coding, they're going to try to teach you in 2 months, 4 months, or 6 months, that is not the program that you want. That is entirely too fast to learn medical billing and coding, and there is no way. It does not matter if you have been a nurse prior or you have some other medical background. It does not matter. With learning medical billing and coding, you have to learn a minimum of 3 different manuals, okay? ICD-10-CM, which is the diagnoses, the CPT, which is the current procedural terminology, and that's all the outpatient procedures, and there's a lot more that goes into CPT as well. And of course, HCPCS, and that's for your durable medical equipment and other procedures and services in that book that are insurance specific. Then, if you're going to learn the inpatient side, there's also ICD-10 PCS. But at a minimum, new medical coders are going to learn at least 3, okay? There is no way that if you're going into a program and they say, oh yes, we can teach you how to learn medical billing and coding in just 2 months, 4 months, or 6 months, that's not the program that you want. It doesn't matter if they are cheaper. If this is something that you think you can afford, you may as well be throwing your money away because it's entirely too fast. There are other alternatives that I'm going to get into to learning medical billing and coding, and I'm going to get into those at the end. But I just want to say this first part if you're looking at a particular school, okay? That's number 1. Look at the time that they're telling you that you can get to this program. If they're saying that this program is 9 months, 12 months, or 18 months, that is a good time to go through, okay? Because that's more reasonable. It's still a lot in 9 months to learn, but it's a lot better than trying to learn everything in just 6 months or less, okay? It does not matter what the person tells you. It does not matter what they say. I'm telling you, as a veteran medical coder and as somebody who knows what the employers are going to be looking for and the appropriate length of training, I'm telling you now, you need at least 9 months, 12 months, or 18 months. And there are plenty of schools out there that have reasonable rates on their programs. So if the first one that you pick is like 6 months, that's not the one that you want. The second thing that you need to look for is what credentials are they preparing you for? This is very important. If the school does not know what credentials you can sit for after the program, that's not the school that you want. If the school is not preparing you for a HEMA or AAPC credentials, that is not the school that you want. You want the school that is going to prepare you for the CCA, the Certified Coding Associate, the CCS, the Certified Coding Specialist, the CCSP, the Certified Coding Specialist Physician-Based, or the CPC, the Certified Professional Coder, okay? These are the 4 main medical coding certifications that employers look for, okay? Each one of these says a different thing, but these are the ones that you're going to be looking for. CCA, CCS, CCSP, or the CPC. If that school is not training you or getting you prepared for one of these 4, that's not the school that you want. Because, again, when you're out there and you're going to be applying for these jobs, once you complete this program, they are going to look at you and they're going to want that certification. If you are not prepared or you went through a cheaper program and this was all that you could afford, it's still not an excuse because, again, I will get into the alternatives at the end. But again, that's not the program that you want if they're not preparing you for a HEMA or AAPC credentials, okay? So that's another thing you have to look for. And ask them that, okay? It does not have to be accredited when you're talking about the medical coding certifications. When they say we're accredited, we are accredited, the only time that you need to be concerned about accreditation is if you're getting one of the degree designations, the RHIT, which is the associate's degree, the Registered Health Information Technician, or the RHIA, the Registered Health Information Administrator. That is the only time that you need to be concerned with accreditation. Now, they're going to try to talk this big fancy talk about these medical coding certifications, and oh yeah, we're accredited. No. Again, they're trying to sell you a dream, trying to sell you a product. That's all they're trying to do. And they clearly don't know what they're talking about when they say, well, oh, we're accredited. It's fine to be accredited, but again, it only matters if you're going for one of the degree designations, okay? And that's something completely separate because a college degree is not going to support you for medical coding, okay? The degree designations are for our leaders, okay? They're for the auditors and they're for those folks that are going to be in management or the supervisory roles, okay? There's a lot of hospitals that say, oh yes, if you have a degree, that's fine, or if you have a medical coding certification, that's fine. The medical coding certifications hold just as much, if not more, weight in this industry because of the simple fact that when you're talking about coding, it's very important to have these things. Again, the RHIT, the RHIA, those are for our leaders. Those are the people that are going to be managing the folks that are going to be doing those things. So, with that said, it's different roles, different responsibilities. And that's something that you have to know. But make sure that the program that you pick is going to be preparing you for the CCA, the CCS, the CCSP, or the CPC. Okay? So that's another thing that you have to watch out for. The other thing, number 3, that you have to look for or ask them is about the instructor. This is very important, okay? You need to see if they will let you speak to the instructor of the course. If they do not want you, or if they refuse, or if they're saying, oh, they're hemming and hawing and making all kinds of excuses that you can't talk to the instructor, that's not the school that you want. Keep looking, because there's trust me, there's plenty of other schools that you could be going to, okay? But the reason that you want to speak with the instructor is you want to get a feel for their demeanor. You need to know how they're going to respond to your questions. Because some people say, oh yes, I got into this program. They say that they had an instructor and the instructor was going to help me. And then when I started to ask questions, the instructor got mad at me. This is the time before you hand over your money or before you sign your name so that you're guaranteeing them that money. This is the time that you need to get with that instructor and meet them and ask them these questions. When was the last time they worked in the real world? Okay, when was the last time they coded in the real world? If they're telling you, oh yeah, well, the last time I coded, it was in 2010. That was in ICD 9 times, and we are now in ICD 10. So that's something that you got to be mindful of. Anything prior to 2015 was ICD 9. If they're telling you that was the last time that they had coded was in 2014, again, that's not the instructor that you want because they have no real world ICD 10 application experience. You want somebody that's going to be able to understand these things very clearly. Now, the reason, again, that I say this is because some schools, they say, oh yeah, this person, has a degree and they have all these years of experience, but they didn't really pay attention to the last time that person was in the field working. So then that means if that person hasn't been working since ICD 9, they're only training this from a book and they don't know the fundamentals of application, okay? They may have been able to pass a test and they may have some kind of knowledge, but they're not going to have that real world experience that's going to help you to understand what's really being said in these books. Okay, so that's something that you need to ask them. When was the last time they worked in the real world? The second thing is, do they have a valid current certification in medical coding? Not just an RHIA or an RHIT, because again, those are degree designations. You are looking for them to say, I am certified CCS, CCSP, or a CPC, okay? Those are the ones that are going to be in those teaching positions, okay? Not generally a CCA, because I know that most of those programs are looking for people who have not just the entry-level certification for medical coding, which is the CCA. CCA is still a fantastic credential, guys. I had it for 13 years. But for most part, when you're looking at these schools, they're going to want the people to have higher level certification, because that would mean they have more experience. Okay, so that's the reason for that. But that's what you want to ask them. Is their certification valid? Because I have heard many a horror story where the teacher was not even certified in medical coding. They just had a degree, and that's it. So that's not the person that you want to be learning this from, all right? I've seen a lot of people talk on LinkedIn. These are brand new students, and they're really mixing up the whole thing about medical coding. And they get so excited because they think that they understand. And what they're saying is clearly like, okay, who is teaching you? Because that's not even right, you know? So that's something that you really have to pay attention to. And when you're seeing things that the person is saying to you, like if they're certified and it is current, that's somebody, okay, you're starting to build that trust. Now, you asking them questions should not upset them. If it does upset them, as far as like, okay, why are you questioning me? Why are you No, you're doing your due diligence. You're doing your due diligence, and you're really going into like, okay, discovering what it is that, you know, I'm going to be going into, and I'm going to be learning from this person. I have a right to ask these questions. Okay, so then getting that feel for that person is going to help you to know, okay, this is a teacher that I can trust. This is a teacher that I know I can learn from, because there are some really fantastic instructors out there. Don't ask me for specific ones, but I don't know every school in the world, but I do know that there are people who love medical coding as much as I do, okay? And because of that, that's a great person to learn from, because that's a person that's going to be really enthusiastic about teaching and really enthusiastic about helping other people to learn. And that's who you want to learn from, okay? You don't want to learn from somebody who's just there to proctor from a book and just teach just whatever willy-nilly. You don't want that person. You want the person that's excited about medical coding and excited that you're going to be there and that you're going to be on your journey there with them, okay? And that's what you're looking for when you're interviewing this instructor, okay? So ask them, when was the last time they worked in the real world? What certification do they have? You know, those are the questions that you're looking for. And you're also watching how they respond to your questions. And if you have questions, how do you go about asking them? Is it going to be by email? If it's going to be by email, how long does the response take? Because there's a lot of people who say, oh yes, your instructor is going to be available to you whenever. You just send them an email and they will email you right back. And people have said that it was 6 weeks and their instructor just barely got back to them because of the amount of students that they have. You know, these schools, some of these schools are not really interested in the quality that they're teaching, because again, they already have your money and they're going to give you what they promised you, which is all of this curriculum, and whether you pass or fail is up to you. It is nothing on them. That's the way that they're going to be showing it. Okay, so that's something that you have to pay attention to. And talking with the teacher is going to be like, okay, that's where you're going to get that feel. And if you don't get those warm and fuzzies, go to another school. Try to look at another school and try to get schooling that way. Because again, it's not worth it just because the program is cheaper. And a cheap program is still a bad program and still going to be a waste of your money if you're not learning anything, right? And you want to be able to learn. And that's what you're doing when you're out there and you're looking, okay? The other thing is, what all is included in this program? What books are you going to get? Now, there's a lot of schools that will include the books. Some of them will be by the AMA, some will be by Bucks. They will give you the books to learn from. I personally do not like Bucks. Bucks, to me, is not a very good book to learn from when you're brand new, when you're a brand new medical coder. Because the way that the Bucks books, in my opinion, okay, this is my opinion alone, the way that the Bucks books are written is written for somebody who already understands what they're doing. It's not written for people who are brand new. Now, the book that I recommend that you can learn from, if you do happen to get a Bucks book, and you say, okay, well, I'm not really doing too well with this one, the book that I recommend is in the description box below. It's by Nellie Leon Chizen, and it's the ICD-10-CM and ICD-10-PCS coding handbook with the answers. There are two versions of this book. There's with the answers and without the answers. You want the one with the answers, clearly, because that's going to be the one that's going to help you to learn. And then you can always cover up the answers. You can work through the problem, and then you can uncover and see how you're doing from there. And that book is very well written. It's straightforward. It is wonderfully put together. So that's, again, what I recommend for people who are going to be learning on their own, okay? Or if they're in a program and the book is by Bucks, but they still want to go to that program, but they want to learn on their own, you can supplement with that book, okay? So the other thing that you need to be on the lookout for is if they're pushing you. If they say, okay, well, yeah, you have till Friday to take advantage of this offer that we have, and we're going to take $200 off, or we're going to take $600 off of the total program cost, and, it's going to be on sale, but, you can only act till Friday. That is a sales tactic, and you don't want that. So don't be pressured. There's a lot of schools, and there's a lot of competition out there for medical billing and coding programs. So don't pick the school that's trying to rush you into making a decision. If you don't want that program, if something feels off about it, again, move on to the next school, all right? You don't have to be suckered into that school. I'm just saying. So with all of that said, the final thing that you want to look out for is if they're saying, oh, well, we include an externship with this program, and we'll help you to find a job. Sometimes they will say this, and they will say, oh, yes, we'll help you find a job. And it's actually like for a secretarial position, and actually not something that's actually medical coding related. So if they are offering this, make sure that it is going to be medical coding related. If it is something that is, it's a secretarial position, that's not what you want, because you are not going to school to be a medical secretary. You are going to school to be a medical coder. And yes, while a lot of employers want coders to have experience, here's the thing, guys, this is a secret. They want you to have really good training. And there's a lot of these schools that pump out these medical coders that are ill-trained. And so because of this, that's why they don't want to have to take the time to train people, because they are a business and they're not going to be a school to teach you. However, if you are learning, and if you are applying yourself, and if you are persistent, you will get hired, because of the simple fact that that's what it takes. This is part of the shaping process. This is just the industry itself. The industry has always been this way, where they do, put the brand new coders through the ringer as far as like, it's really hard to get in. Yes, even I had a hard time getting in myself. But you have to be persistent. You have to go through the other avenues. You have to be creative, and that is how you get in, okay? But if they're offering you an externship somewhere because they say that to get experience and it is legitimately medical coding, then that's fantastic. And then you just found a diamond in the rough. But if they don't and they say, oh, well, it's because we're going to get you a secretary position, whatever, then that's just part of a selling gig, and you don't want to be a part of that. Okay, so with all that said, if you're running around looking at these schools and trying to decide which one, this is the only thing that I will recommend, me personally, because a lot of people will say, well, what about this program? What about that program? Any specific schools that are mentioned in the comments, it's immediately deleted because of the simple fact that sometimes people will say, oh, what about this school? And they're actually advertising for that school. I've been around YouTube long enough to know that that's how they try to do this and how to try to get the word out about their school. Meanwhile, their school is lacking really bad in a lot of areas. So no, we're not playing that game on my channel, okay? But that aside, again, I will not answer about specific schools. I've done videos about specific schools, and you can go through my videos and find those. But what I will recommend is going directly to the associations themselves, the American Health Information Management Association and the American Academy of Professional Coders. You can just pick one or the other, okay? Both of them have options for payments. With AHIMA, you can buy the whole product all at one time, and it comes out to a little under $5,000 for everything. That's the tuition and then the books, okay? Because they're going to charge separate. However, if you do that, if you buy the whole thing at one time, then it's only going to give you 365 days to get through everything. If you don't make it in 365 days, then you lose your money because there's no extension on that. So if you want to buy a la carte, which is a lot cheaper and more reasonable financially for some folks, because they can do that and it's more reasonable for them, then that's better because then you get a little bit more time. You can take your time with the courses and things like that. So that may be a better option for you, and it would certainly be a lot more reasonable as far as the cost goes, okay, for learning, all right? Then there's the American Academy of Professional Coders. Now, they have their online medical coding programs as well. There's a lot of sales all the time with them. You do have to be a member to be able to sit for their certification exam, and sometimes that membership is already included in their package. You have to look, you have to add and do all that stuff on their website because that's just the way that they do it. They have a very simple, straightforward website. I really do like the AAPC setup on their website because it is, again, very straightforward. With AHIMA, you do have to look in the top, when you go to the AHIMA landing page, ahima.org, in the top right corner, there's going to be a button that says AHIMA Store, and that's where you want to go to look for all of the training programs that they have, and then it has the breakdown of the prices and everything. There's a different price for members and non-members. So if you get a membership with AHIMA, you do get a little bit of a discount. So that does help, and you get to get access to a lot of other things that students normally wouldn't, having that membership. Okay, so that's something that you have that option there. And AAPC, of course, they allow for payments on their program, and you have to go through AAPC to check that out and get more information about that. But their programs they're directly from the associations, so that's the only reason that I recommend them. I have not been through either program, but again, because it's directly from the association, that's the only reason why I can say that that's an option that you have, that I can for sure talk about. Now, the last option, of course, is the independent study. There is the syllabus with all of the books that you can purchase down in the description box below. It's under independent study. It's got all of the books that are listed, everything that I recommend for you to learn from, right? And it has the breakdown of the times to spend on each subject. So if you want to do that, you totally can. You need a lot of self-discipline to be able to get through that one, because there's not going to be somebody on you pushing you to get this done. You don't have a deadline unless you give yourself a deadline, okay? So that's something that you may want to consider if you're wanting to learn, but you want a cheaper option than going through the school, or maybe you're not learning from this school or whatever. It's just another option for you. There's also the public library where you can get a lot of those books, and you can check them out there, and that way you can learn from the books, the medical terminology, the anatomy, the pathophysiology, and that's great. There's a lot of online resources for HIPAA and everything else that you need to know. There's a lot of reimbursement stuff out there as well on the internet. So that's something that you can do, because none of these medical coding certifications, the CCS, CCA, CCSP, or the CPC, None of these require you to go through a formal program. You can study on your own and then sit for the test. Any one of these. You only need one. You do not need two. You only need one. Okay? So with that said, that's my video for today. But those are the things that you need to look out for, guys. And be the educated consumer when it comes to trying to find these programs. Don't just get sucked in and don't just sign up for this program. Oh, I'm going to have multiple credentials because, I signed up for this program. It's going to give me 2 or 3 credentials by the time I'm done. You only need one, okay? The more credentials you have when you're brand new, the more you're going to have to put out in money in order to cover for those CEUs in order to maintain all of those credentials. So like I said, just get one. That's my advice anyway. So with that said, I'm going to wrap this one up. Thank you guys so much for joining me. Best of luck to you. If this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.